We did our project on the role of nursing assessment in decreasing maternal mortality and severe maternal morbidity, educating third-year nursing students.
As an introduction, we've included some statistics on maternal mortality and nursing education and knowledge on these topics. According to the CDC Morbidity and Mortality Weekly Report, approximately 700 women die annually in the U.S. from pregnancy-related complications. Over the past 3 decades, maternal mortality rates in the U.S. have not decreased, in contrast with other countries with high healthcare expenditures, where maternal mortality rates have declined to levels as low as 4 per 100,000 live births. Additionally, the highest percentage of maternal deaths occur during the postpartum period, when compared to the antepartum or intrapartum periods. The postpartum period is also the time when women have the least interaction with the healthcare system. In a survey completed with 372 nurses who work with women during the postpartum period, only 54% of the nurses indicated knowledge that maternal mortality rates in the U.S. are rising. Additionally, only 12% knew the percentage of these deaths that occur during the postpartum period. 67% of the nurse respondents indicated that they spent less than 10 minutes with patients educating them on potential warning signs.
Due to COVID-19, education was implemented through a recorded lecture with a video component in the individual OB clinical groups, instead of during the lecture period. Clinical instructors were able to utilize the education session at their own pace and were encouraged to pause for discussion and for the case study. So we narrated a slideshow presentation, including a video and an interactive case study, and we distributed this to clinical instructors to present and work on with their clinical groups. These groups were junior OB nursing students. We also created an acronym as a memory and education tool to help students remember critical assessment data to collect. And lastly, we had a pre and post test containing the same 5 questions to assess students' knowledge before and after attending the education session. The assessment screening tool is just another mechanism to aid in collecting critical assessment data from patients. ABBANE stands for ask, bleeding, vital signs, emotions, incision site / episiotomy, neurological symptoms, and swelling.
In order to assess the effectiveness of our education, we wanted to base our questions on the application of knowledge in the practice setting. We utilized these same 5 questions in both the pre-test and post-test. Students were instructed to take the pre-test assessment prior to the clinical day in which they would be receiving the education, and were then supposed to take the post-test immediately after the education session. Unfortunately, we had some inconsistencies in responses between the 2 tests, and only had 18 responses to our post-test, even though there were 39 responses on the pre-test. Despite this inconsistency, a higher percentage of respondents answered correctly on the post-test than on the pre-test for all 5 questions. One question we wanted to highlight was the question on the WHO definition of maternal mortality. On the pre-test, only 33.3% of respondents answered correctly, but 72.2% answered correctly on the post-test. We would certainly recommend a larger study with a bigger group of students in the future, and ideally with an in-person delivery, but the data is promising that the education session was overall successful.